Good evening, everyone. This is Diane Pickles, and I want to welcome you to tonight's webinar. And I'm actually going to introduce Stephanie Bozarth, who's going to kick us off this evening. Stephanie, I'll turn it over to you.
Hi, everyone. Thank you so much for joining us. Again, this is a webinar that we are starting an education series this year. And Diane Pickles with M&R is helping us to conduct the first series, which is How to Tell Your Story. My name is, again, Stephanie Bozarth, and I am the Advocacy Chair for this committee. So I will pass it back to you, Diane. Thank you.
Thanks so much, Stephanie. So it is really a pleasure to be with you all tonight. I wanted to start by just giving you a very quick introduction to myself and to M&R. M&R Strategic Services is an advocacy consulting firm. We're a national firm based in Washington, D.C. I work out of our New England office, which is in Massachusetts, and I have had the great pleasure of working for the National MPS Society for the last, probably 5 years or so. And it has been truly an honor and a great privilege. And I work with Stephanie and the Advocacy Committee, basically helping do grassroots advocacy around the federal policy goals of the society. I also, it's such a pleasure to do this work because I also have my own child with a rare life-threatening disease. And so tonight's topic is particularly important to me as I have shared my own personal story and worked with a lot of advocates both professionally and personally as a volunteer to really help folks learn how to tell their story and do it impactfully in the most effective way. So we are going to dig in quickly tonight, but deeply, to really help you learn how to do that in a very compelling way, to really share those personal stories to be effective in advocacy. I wanted to start, though, by really talking about what is advocacy and share a very quick definition. When we say advocacy, what we're talking about is the application of pressure and influence on the people and institutions that have the power to give you what you want. So if you think of this adorable little boy who wants a puppy, he is an advocate. He wants a puppy, and he knows that there are decision makers in his house, his mom or his dad, or maybe both, or maybe it's a grandparent. And he knows that for each of those decision makers, there are certain things that will push their buttons. There are ways to apply pressure and influence, and that it's different for each of those key decision makers in his house. And he knows how to apply pressure and influence. He might be extra sweet, make promises, maybe apply guilt. We are born advocates, and we know how to do it. And it's really the same set of skills, but when we're doing public policy, we're just applying those skills to policy. And in this case, for the society, we're generally doing that on the federal level with our members of Congress. So that's really all we mean when we talk about advocacy. So how do we do that? How do we apply pressure and influence? There are a couple what we call key power tools or key strategies or tactics, you might think of them, that we do or utilize to really apply pressure and influence. Research and data, for sure, is really, really compelling and important, and we rely on that to make our points, both to describe the problems we're looking to solve and also to support and defend our proposed solutions. We work very often in coalitions, and you do this in the rare disease community very, very often, RDLA and NORD and other groups where you work together as organizations that come together to collaborate because there is power working collectively, power in numbers, and so we work in coalitions. Media advocacy, a very powerful advocacy tactic, letters to the editor, op-eds, editorials, articles, where we really use those media tools, social media as well, to apply pressure and influence on decision makers. Lobbying, for sure, that's the one most people tend to think of when they think about advocacy. And last, but by no means last, is grassroots, or least is grassroots. I actually, in my long experience working in advocacy, would say that grassroots is probably the most important. I really have come to believe that. I've seen a lot of well-executed campaigns, and I've seen a lot of campaigns that have gotten lucky. But I think that most of the campaigns that I have seen fail have failed because they have not done a good job executing a strong grassroots strategy. And in my experience and in my personal belief, real stories are probably the most important tactic in terms of grassroots advocacy. And I've got a couple slides to help make my case along those lines. And here's the first one. So we don't have a live line tonight, but I want you to take just a second to try to match up the names on the left with the causes on the right. So just take a second and see how many you can match up. Now I'm going to bet, based on my experience doing this with live audiences, that you got most of these correct. Most people, when we do this in audiences, can name most of these correctly. They might miss one, maybe two, but they know that Gloria Steinem is feminism and Rosa Parks is civil rights, and so on and so forth. So here's a harder quiz. I want you to try to match the numbers or statistics on the left with the causes on the right. And this is obviously much harder. The hint here is they go left to right. So 50,000 is the number of coal miners in the United States, 480,000 tobacco-caused deaths, etc. The point here is obvious. It is much harder to remember numbers and much easier to remember names and stories. And that's because of the stories behind the names. We remember stories. People are memorable, and that's because they evoke emotion. And that's why when causes utilize and match up real people with their causes, they are much more memorable than just when it's a statistic or a number. Here's another example to help me make my case. This is a woman named Diane Jones, who some tobacco control advocates several years ago met Diane Jones when they did what we call a Tell Us Your Story appeal. So they're working on a secondhand smoke-free workplace campaign in Ohio, and they sent out an appeal to basically say, share your story. If you have been impacted by secondhand smoke, tell us your experience. And Diane wrote in her story, which was really a double story. She herself had been a smoker for 23 years. She had quit smoking, but subsequently, unfortunately, had been diagnosed with COPD, chronic obstructive pulmonary disease. But sadly, she also had lost her best friend, Sherry, 5 years previous to lung cancer. And Sherry had died at the age of 50 years old. She had never been a smoker, but she had worked as a bartender. And Diane really believed that her friend Sherry died from lung cancer because of the exposure in the bars where she had worked. The point of this is that when Diane's story was shared through radio ads and in newspaper advertisements, each day her story was shared, approximately 100 people who heard her story went to the campaign website and took action, meaning they sent an email to their members of the state legislature in response to hearing Diane's story because of the power of her story, because it was so personal and it made them feel something for the issue. And prior to Diane's story running in these advertisements, the Ohio Smoke-Free campaign was a little bit limping along. And Diane's story is what really gave the campaign a jump start that was much needed at that time. The power of stories cannot be overstated. It just makes people feel the issue in a way that data and facts and statistics just can't do. So I hope I've convinced you quickly, but I want to talk much more in depth now about, how to do it well. So stories really are among our most powerful advocacy tools, but it takes some skill to tell them well. And that's what I really want to focus on tonight. There's a couple reasons that I think it is a skill that takes developing. First and foremost is that when we meet with lawmakers or members of an administration, key decision makers, we have a very quick opportunity to get their attention. We have a very short period of time in which we're meeting with them. They have a lot on their plate. They're hearing from a lot of people, and we literally have a minute or less sometimes to really capture their attention. Less really is more. We really have to narrow our message and be very, very succinct and brief. And our goal, therefore, has to be to generate interest and create curiosity. We don't want to give them our whole life story. We want to give them just enough to spark that curiosity and get them to sort of stop and say, wow, I'm really curious about that, and I'd like to hear more about that. And what that means is that what matters to us, all the details in our life, aren't always relevant or impactful for that decision maker. And that can be very, very hard because we have a lifetime of experience that we bring to this. It's not all relevant and impactful, and we have to unpack that and try to pull out what is going to be relevant and impactful for that decision maker. The last piece is that emotions are what I think of as kind of tricky. And what I mean by that is not that we should not feel the emotion in our story. Your stories related to NPS are emotional, and that is valid and authentic, and you should bring that to the storytelling. What I mean about being tricky is that I think you have to balance that with your ability to tell the story, and also that you have to just sort of acknowledge that for the listener, we have to balance out that as well. And so I just think it's sort of a tricky balance of sharing facts of the story and the emotion of our story. And it's just sort of a balance that I think we as the storyteller need to get comfortable with. And so I think that's a tricky balance that we just need to sort of work through as the storyteller. So we've developed a framework. Actually, we did not develop this framework. We have adapted this framework from others who have used it, called the 2793 elevator pitch message. And this is to help you create an elevator pitch, a very, very short, compelling message to tell just sort of a little bit of your story to capture the attention of a decision maker in a very short period of time. So think of this as sort of the very brief message that you could say out loud as you introduce yourself, as you start a meeting, or as you meet them at a town hall meeting, or whatever that may be. And I'm going to walk you through this framework, then give you a couple examples, and we'll leave you tonight with you'll have the webinar recording, you'll have the slides, and we'll also leave you with a tool that you can use to create your own 2793 elevator pitch message. So here's how this works. There are a couple questions you start by asking first. And the first question is, who is your audience? So you really want to start by saying, who is it that I'm talking to, and what is it that they care about? Who is it? Is it my federal, state, or local lawmaker? In most cases, for the National NPS Society, you're talking to your members of Congress. But who is it? Who is that audience? The second question is, what do you want them to think or understand? Next, what do you want them to feel? And what do you want them to do? And the reason we want to ask these questions on the front end is because that will help us really craft a message that is much more targeted and specific and brief. And so we ask those questions of ourselves first, and then we work to develop our 2793 elevator message accordingly. And here's the 2793 rule. The 2793 rule is that your elevator message should be no more than 27 words, delivered in 9 seconds or less, and it can have up to but no more than 3 points. So it can't be a bullet list of 6 or 7 points. It can be no more than 3 points. You have to have a point, but you can't have more than 3. So I'm going to give you a couple examples of a 2793 elevator message that have been crafted after answering those core questions. So these were developed by some of our friends, our colleagues, our clients rather, at the American Heart Association. So there's two that I've pulled out. Cardiac arrest kills 250,000 people yearly. In 2001, one of those people was my husband, Joel. If an AED had been available, it could have saved his life. I think this message is 25 words, very, very powerful. I love that she used his name, Joel. And I think it's very, very short and to the point. She doesn't give a lot of details, but just enough, I think, to capture that listener's attention and really powerfully capture their attention. Here's another example also from American Heart Association. Despite having private health insurance, the out-of-pocket cost of copays and deductibles for my son's 3 open heart surgeries caused devastating medical debt. Again, not all the details, doesn't give a diagnosis, doesn't talk about the details of 3 open heart surgeries, but just gives enough information to say, and be surprising to say, despite having private health insurance, it caused devastating medical debt. So hopefully just enough information to capture the attention of that decision maker. So those are 2 examples of 2793 messages using this framework. So a couple quick do's and don'ts to be thinking about as you put together your 2793 messaging. Do revise and practice your message until you are comfortable with it, until you're happy with it, and until you're comfortable saying it out loud. I really recommend finding a partner, practicing, find someone that you can practice saying it out loud to. These are messages that should sound good to the ear. They need to be said out loud, so you need to practice that. Have your elevator message and then a few bullet points as a follow-up. And I mean a few bullet points as follow-up. You want to make sure that you are prepared if that decision maker says, wow, tell me more about that you are prepared to respond and still be very targeted and concise, and that we're not rambling on, but that we can really answer their questions, but again, do that in a very targeted way. So I recommend having a few bullet points laid out on paper, and that you've prepared saying them. Do be yourself, be authentic, bring your own self to this. We don't want to sound like robots. We want to sound like who we are as people, and that's really important. Do use visuals, have a photo of your child or your family. If you're talking about the cost of MPS or related diseases and you want to bring a stack of medical bills as a visual, do that. But think about ways that you can make things visual and more memorable as well. And again, remember the goal is to generate questions and interest and discussion. That's definitely our goal. Don't try to be a lobbyist. That's not your job as the storyteller. As a storyteller, your job is to be the storyteller. Don't ramble or talk too long. That is truly the kiss of death in sharing a personal story. And again, I find in my own experience doing this that I think if I'm not prepared to tell my story, it is easy for me to ramble on because there's so much that we've lived through that it's easy to get caught in the weeds of that myself. And lastly, don't take reactions personally. And what I mean by that is that lawmakers are very busy people. They have a lot that they're dealing with. Sometimes, quite frankly, them or their staff don't necessarily have the best manners hearing a personal story. You're bearing a very personal, you're sharing personal, deep things. And don't take it personally if the reaction you receive is not necessarily one of great interest and responsiveness. I just think we have to, I want to prepare people that sometimes we don't always get the response we expect. And I think it's important that we don't take that personally. If you have an opportunity to expand on that elevator message, less is still more. And we definitely want to remain focused. So again, let those bullet points guide you. Be prepared for those and allow for questions and conversation. This is a great time for really allowing for some dialogue with that lawmaker. And often the MPS Society will be sending people in a group with meetings, and this is a great opportunity for there to be some conversation and discussion. But if you're meeting your lawmaker out at a town hall meeting, allow for some conversation. Don't feel like we shouldn't be doing all the talking. So to really allow it to be a dialogue. And lastly, allow the lobbyist, and sometimes that will be you, but where we are making a policy ask, we have to connect our story to that policy ask. And so this is a larger issue than I can fully tackle in a brief webinar, but I just want to sort of flag this, that for those of you who are involved in meetings where we are making a policy ask, there needs to be a connection between the story and the policy ask. And that is not necessarily done by the storyteller, but it needs to be done in some way during the meeting. So lastly, the last thing I will leave you with is just this quote that I think is a great reminder that there are two ways to share knowledge. You can push information out, or you can pull people in with a story. And I think it's based on the information I've shared with you tonight, I think it's obvious to say where my bias lies in terms of which is more effective. And that really pulling people in with a story is definitely, in my experience, much more effective for advocacy. But again, it needs to be done well. And it is a skill, and we get better with time. So with that, I will say that we are going to make available to all of you the webinar recording, the slides, and there is a handout as well that will summarize the tool and how to use it that we've shared with you tonight on crafting your 2793 elevator message. My email address and my telephone number are here. I want to let folks know to please feel free to reach out to me if I can be helpful. And you will get an email after the webinar letting you know how to access those materials online. With that, I will turn it over back to Stephanie to see if you have any final words before we wrap up for the evening.
Hi, Diane. Thank you so much. That was really great. Is there any questions from anyone? I didn't see anything come through on my end. Did you, Diane?
I did not. I did not let people know how to submit questions. And actually, I think probably the best way to do that is to say, if folks have questions, I would be happy to take them in writing by email after the webinar. So please feel free to submit them. I haven't seen anything come in during the webinar.
Okay.
Please definitely feel free to reach out.
All right. Well, thank you so much, Diane. That was great.
Thank you, and have a wonderful evening, everyone. Take care. Bye-bye.
Bye-bye.